Hello guys, this is Nashath from group 29. Today I'll try to talk my best on ultrasound of heart, vessels and abdomen. Uh, when we look into the ultrasound of heart, what exactly is this? A bedside cardiac ultrasound or echocardiogram. This is a quick point of care ultrasound that allows you to visualize and evaluate how the heart is functioning. In addition, bedside echocardiography also allows you to evaluate hemodynamic changes and pathological heart diseases. The cardiac ultrasound procedure is also known as echocardiography, echocardiogram, or even just as echo. They are referred to the same thing. Now, in addition to these things, you may also see that cardiac ultrasound referred to as the transthoracic or transesophageal echocardiography. These two are actually not the same thing. So the transthoracic echocardiography, the TTE, this is when the cardiac ultrasound is performed on the patient's chest. TTE is the most common cardiac ultrasound application and this is non-invasive. The TTE is what we will be covering in the post. And the TEE, which is the transesophageal echocardiography, this is a more specialized cardiac ultrasound. This is used with a special probe, which is inserted into the patient's esophagus. TEE requires sedation and is considered a much more invasive procedure than the TTE. So, what are the indications of cardiac ultrasound? These are the main indications which I wrote down. One being the chest pain, shortness of breath, hypertension, new heart murmurs, dizziness, and cardiac arrest. So let's say if a patient comes with indications like chest pain, this might indicate that there is LV motion abnormalities or failure of certain parts of the LV to contract, and it also suggests acute coronary syndrome in the appropriate clinical setting. And for example, if the patient has shortness of breath, this may suggest that he's having acute coronary syndrome, things like pulmonary embolism, maybe endocarditis as well. And about hypertension, this might indicate massive or submassive pulmonary embolism and cardiogenic shock and pericardial effusion with tamponade physiologically. So, how to prepare the patients for cardiac ultrasound? The patient should be in supine with the head of the bed flat. If you are unable to visualize the heart in supine position, consider repositioning the patient into the left lateral decubitors. This will bring the heart away from the sternum and give you better sonographic access. As you can see in this picture, before we go into detail of ultrasound, we need to look into the cardiac ultrasound anatomy. This is really basic, which you already learned 1,000 times. So in here you can see that there is 4 chambers: the right atrium, right ventricle, left atrium, and left ventricle, and that these are separated by their respective valves: the tricuspid valve, the pulmonary valve, mitral valve, aortic valve, and this is the basic 4 views that I'll be discussing today, and these are considered the basic 4 views. One is Parasternal long axis, One is parasternal short axis, apical 4-chamber, and subxiphoid 4-chamber. So in parasternal long axis view, this is usually the first cardiac ultrasound view obtained, and this will give you an immediate assessment of the general condition of the heart, including ejection fraction and overall left and right ventricular sizes. So in here in the picture you can see that the point of the probe indicated toward the patient right shoulder, and we're supposed to place the probe at the fourth intercostal space, which is approximately the nipple line for males, and for females it's the inframammary fold to the sternum. The structures that we find in PSLA is just the normal structures like the right ventricle, left ventricle, right atrium, aortic valve, mitral valve, aorta, the descending aorta. While doing the PSLA, in order to optimize the gain to visualize the different chambers of the heart in view, optimize the depth to make sure that you can see the descending aorta. And if you're having trouble orienting yourself, just remember the 3Ls. For the parasternal long axis view, to the left ventricle is on the left side of the screen. That's the 3L. On the right you can see the cardiac ultrasound. The parasternal short axis view, in here this view is often abbreviated as the PSSA or PSAX, and from the parasternal long axis view we are going to rotate the probe 90 degrees clockwise, so that the indicator is now pointing towards the patient's left shoulder. In the picture you can see the hand and probe position for the parasternal short axis view. And these are the three main levels of the parasternal short axis view. The first one is the mid-papillary level, and second one mitral valve level, and the last one is the aortic valve level. The apical 4-chamber view. In here also you can see the hand and probe position for the apical 4-chamber view. There's the changes like from the parasternal short axis view, slide the transducer toward the apex of the heart, keeping the indicator pointed towards the patient's left side. And once you reach the apex of the heart, as indicated by the left ventricle decreasing in size, tilt the tail of the probe down towards the patient's foot. For females, the point of maximal impulse, the PMI, this is usually just under the left breast. In FOC also you can see the structures like the left ventricle, left atrium, right atrium, tricuspid valve, mitral valve, and it's important that if you're having trouble getting the apical 4-chamber view, just try placing the patient in the left lateral decubitus position, so that it will reduce the lung artifact and bring the heart more proximal to your ultrasound probe, and this usually will give you an optimal view. This is the last view, the subxiphoid view. The subxiphoid, also known as the subcoastal view, this allows you to see the similar structures as the apical 4-chamber view, but just approach from a different angle. The subxiphoid view is useful when you are having difficulty getting adequate parasternal views, or when you are evaluating a trauma patient when doing the IFA scan. So how do we do this? We ask the patients to bend their knees and position the probe under the coastal arch with the indicator pointing towards the patient's left side. And since the plane of the heart is superficial, you need to use the overhand grip on the probe in order to be parallel with the skin. Here's the structure that we find in subxiphoid view. The right ventricle, left ventricle, tricuspid valve, mitral valve, left atrium, right atrium. And it is important that we make sure to use the lever as the acoustic window. If you see the picture on the right, you can see the lever. And if you approach from the left side of your view, it will be obstructed by the stomach or the bowel gas. And if you are still having trouble getting a clear image, try applying gentle downward pressure on the probe. So now we'll be moving to vascular ultrasound. The vascular ultrasound, this is a non-invasive medical test which is used to check the arteries and veins in the body. And arteries and vein problem includes the narrowing of area and blockage, dilations, and abnormal connections. How is vascular ultrasound test performed? And here I gave a brief explanation on this. Sound waves image the body's artery and vein in two ways. The first one is the machine sends a sound wave into the body. Then the machine listens for the return of the sound waves. The sound wave reflects off organs and vessels, so the return information makes a black and white image. The second Doppler determines the speed and direction of the flow. The reflected sound waves of the red cell give speed and direction of the moving blood. A duplex examination combines ultrasound pictures and Doppler to check blood flow, and assignment of color to moving blood shows the direction. Color assignment is set by the technologist, so color does not show artery versus vein. And the next part, we are looking for the uses of it. First one is vascular ultrasound of the neck. For example, the sonographer testing the carotid and vertebral arteries for blockage of the brain. Vascular ultrasound of the abdomen, the test for abnormal dilation of aorta called abdominal aortic aneurysm or AAA. Also, abdominal imaging can look for blockage in the vessel feeding the kidneys or bowel. And vascular ultrasound of the legs. Here, the duplex ultrasound of the leg arteries show blockage that can cause leg pain with walking. And duplex ultrasound of the leg vein show clots in the superficial and deep veins. The other name for deep vein clot is deep vein thrombosis or DVT. And vein mapping tests blood flow moving against the gravity, therefore the sonographer tests the valves in the leg vein for leakage. And leaking valves is also known as the venous insufficiency. Moving to ultrasound of the abdomen. The ultrasound imaging of the abdomen uses sound wave to produce pictures the structures within the upper abdomen. This is used to help diagnose pain or distension or enlargement and evaluate the kidneys, liver, gallbladder, bile ducts, pancreas, spleen, and abdominal aorta. Ultrasound is safe, non-invasive, and does not use ionizing radiation. The purpose, there are several major organs in the abdomen. Using an abdomen ultrasound, it is possible to create images of these organs. and this can help identify the abdominal problems that may be causing the symptoms. A doctor may use an ultrasound to diagnose conditions such as abdominal pain, liver diseases, kidney stones, gallstones, inflammatory conditions such as appendicitis or pancreatitis, abdominal aortic aneurysm, abdominal growths such as tumors, pyloric stenosis, and now we'll be looking into the normal anatomy of the organs. On the left side you can see that we have the liver, and the liver allows for effective ultrasound imaging. The healthy liver has a homogeneous echo reflection pattern and smooth contours. The echo reflection pattern of the liver is similar to or slightly higher than the renal cortex. The echo reflection pattern and smooth contours of the liver are best evaluated by imagining the right kidney and the right liver lobe together. On the right side you can see the gallbladder. The gallbladder is best evaluated when the patient is in the fasting state. When the gallbladder is filled with the hypoechogenic bile, the gallbladder wall thickness is usually less than 2 millimeters. When the patient inhales deeply, the gallbladder will appear from under the rib cage, and the gallbladder now lies in the abdominal wall, enabling you to use the echo transducer to push into the gallbladder and evaluate its compressibility. A filled gallbladder will be partially compressible when you push against it. In here you can see on left side you can see the kidneys. The right kidney, this can be imaged effectively using the right liver lobe as the acoustic window. For the left kidney, the spleen can act partially as an acoustic window. When the patient inhales deeply, the kidneys will move in the caudal direction, which may facilitate evaluation of the kidneys. And on the right side you can see the bladder. The bladder must be filled for adequate evaluation. A filled bladder has thin walls with hypoechogenic content. A filled bladder creates a perfect acoustic window for evaluation of the distal urethra orifices in the bladder posterior wall. And here on left side you can see the spleen. The healthy spleen is homogeneous, and this shows the homogeneous reflection pattern, smooth contours, and craniocaudal length about 12 centimeters in adults. The echo reflection pattern is similar to that the liver in most patients. The spleen may also act as an acoustic window for evaluation of the pancreatic tear. And on right side you can see the pancreas. The pancreas cannot be imaged effectively when there is significant air content in the stomach or duodenum, or even in the transverse colon. The renal vein may help localize the pancreas as the pancreas is draped as it were over the renal vein. It may also help to ask the patient to make a round tummy, which will move the pancreas towards the abdominal wall and increase the visibility. The spleen may act as an acoustic window for evaluation of the pancreatic tail. The pancreatic duct has a diameter about 2 to 3 mm in most cases. In here on left side you can see the abdominal aorta. The abdominal aorta is located centrally in the abdomen. This can be difficult to image it effectively, particularly with significant obesity and extensive internal gases. Adequate compression is necessary. And on the right side you can see the appendix. That's all from me. Thank you very much.